Alright, so this last and final unit is going to cover Chapter 5, Chapter 10, and Chapter 16. Chapter 5 is a pretty big one. It covers the respiratory system. There's a lot of diseases and disorders that can go within that system. But it also talks a lot about diagnostic procedures and tests. And we've kind of been jumping around in this textbook, so you've seen some of these before, but this is the chapter that actually goes through those in detail. First up, we're going to cover all of the organs and structures associated with the respiratory system, and then we'll actually get into the combining forms and diseases. Okay, so the respiratory system comprises everything starting with your nose to your pharynx, larynx, down the trachea, into the bronchi, and into the lungs. Now, some of these terms we saw before when we talked about the digestive system. For example, the pharynx is also called the throat, and it has, a separation between the food passageway down the esophagus and the air passageway down the larynx. The larynx is also called your voice box, if you've heard of it as that before, because that's where the vocal cords are located. And then from the trachea, which is also called your windpipe, the air will travel all the way down through the bronchi, down the bronchial trees, to smaller and smaller and smaller branches until you're inside the lungs. And we'll get into more of the different terms in a little bit later. As you can imagine, the job of the respiratory system is to function to help you breathe. There's a few different terms that all mean the exact same thing. Breathing, respiration, ventilation, those are all different words that mean the same thing. And what's happening is that there is an exchange of oxygen, or O2, with carbon dioxide, CO2, between the atmosphere or outside world and your body cells. So it helps your body cells get oxygen and discard the waste of carbon dioxide. So we can kind of categorize respiration. The first of which is external, and this is called inhalation or inspiration. Basically, it means you're breathing in. And so the air that you're breathing in goes through your nose and your pharynx, all the way down the larynx, the trachea, and into the lungs. That oxygen then goes into tinier and tinier branches in the lungs until it gets to the smallest component, these little grape-like sacs called alveoli. And surrounding those alveoli are blood vessels called capillaries. And there's a picture of it in your book on page 140, and you should have it in a diagram handout. But at that portion, or at that part, those capillaries, that's where the gas exchange is going to take place. That's where the oxygen is going to go into the blood, and the carbon dioxide waste is going to come out of the blood and back into the alveoli, so that then you can eventually breathe it out. And breathing it out is called exhalation or expiration. So that's when the carbon dioxide comes out of the capillaries, back into the lungs, and you then breathe outward. Here's just a graphic for you visual people of the flow of air through the respiratory system. You can see inhalation and exhalation. It's pretty much the same boxes on both. It's just the arrows are going in the opposite direction. There's also something called internal respiration, and this is really when the oxygen in the blood makes its way to the target tissues that it was going towards. So the body cells, or kind of the target tissues, not in the lungs, but somewhere else in the body, there's a gas exchange of oxygen there, and then carbon dioxide goes from those cells back into the blood, and then it's filtered all the way back to the lungs to then serve as exhalation. The respiratory system is kind of separated into two different tracts. We have an upper respiratory system, or upper respiratory tract, and a lower respiratory tract. Upper is just your nose, your pharynx and larynx, which are your throat and your windpipe. So if you've ever had an upper respiratory infection, for example, it's localized in those particular areas. Lower respiratory tract is everything from your windpipe all the way down to the lungs. So trachea, bronchi, lungs. You can have a lower respiratory tract infection too, and we'll talk about that a little bit later, but those are kind of the more serious infections like pneumonia. This is just a big overview picture of everything that is associated with the respiratory system, and I will go through and kind of talk about or highlight the key important ones on the next few slides. So starting at the top of the respiratory system, we have the nose. So its job is to basically be lined with mucus or a mucous membrane and very, very fine hairs. And their job is to kind of act as a trap or a filter to moisten the air that comes in and makes it warm to our body temperature, but it also filters out any nasty, bacteria or dirt or whatever, which is why you get snot from all of that building up in your nose. From there we have the pharynx or the throat, serving as both a food and air passageway. And within there, there's kind of two lymphoid tissue structures. There's something called adenoids, which kind of hang in the back of the nasal cavity. And there are also tonsils, which are the traditional tonsils that you might think of, located in the back of the mouth, down a little bit lower in the throat area. And we're going to talk about the lymph nodes in the next system in the next chapter. From the pharynx, the air travels to the larynx, or the voice box, where your vocal cords are located, and then it hits the epiglottis. The epiglottis is a very important structure. It's basically a flap, and its job is to keep a lid on the larynx whenever you are eating food. So it stays closed when you eat food so that the food, as it goes through your pharynx, is directed down the esophagus and into the stomach, because you don't want food going into your lungs. However, we've all experienced, swallowing something down the wrong pipe, and then you kind of cough it back up and then it goes down the right pipe. That's basically what's happening, is the epiglottis didn't do its job and keep the larynx covered. From there, then whenever you do breathe in, that epiglottis opens up and the air goes down your larynx and into the trachea. The trachea has two major branches that kind of come off on either side, and those are called bronchus. And they have one side going into each lung. And then it kind of subdivides farther and farther. It looks like a little tree in tree branches. So as they get smaller, we have bronchioles. And then at the end of those bronchioles, or tiny little branches, we have alveoli. And that's where the air sacs are located, and that's where the gas exchange takes place with the rest of the body. Alright, so you have two lungs. They are sponge-like structures, and interestingly, your right lung has 3 lobes, and your left lung has 2 lobes. And that's kind of to accommodate for your heart, which is also located in the thoracic cavity. Your lungs are covered in a membrane called pleura. It's the same membrane that lines the thoracic cavity. Also in there we have our diaphragm. Our diaphragm, I think we learned a long, long time ago, is a separator between the thoracic cavity and the abdominal cavity. And it kind of expands and contracts as we breathe to aid in that process. And then kind of an arbitrary thing is the mediastinum, and that's the space in between the lungs. So there is a space there, and that's where the heart hangs out, but that's what it's called. It's also called mediastinum also, if I mispronounced. Alright, so these are the combining forms for the respiratory system. I'm not going to go through each one with you because you know how to look up these words by now, but some of these do have more than one term. For example, bronchio and broncho both mean bronchus. Those ones are kind of used interchangeably. Diaphragmato and phreno both mean diaphragm, although we probably are going to use phreno a lot more. Naso-rhino both mean nose. Pneumo, pneumato, and pneumono all mean lung or kind of air within the lungs. But pulmono also means lung. So we'll get into the diseases and disorders when you kind of learn to pick and choose the correct one of those for each situation. Septo means septum. It's a generic term for a wall. And in this case, in this system, we're going to be talking about the nasal septum, so the wall that separates your two nostrils. Sinuso means your sinus. Your sinuses are open air cavities, kind of in between your bones. So if you had a sinus infection, for example, it would be in that space. Or sometimes you can get clogged sinuses where you can feel that pressure in those areas. The rest of them you can kind of look up. I'd recommend maybe adding these terms to the diagrams that you have to use as a study tool. Now we're to the combining forms that we use with the respiratory system, but they don't actually reference the structures of the system. So the first one is atelo, which means incomplete or imperfect. You're going to see this term when you talk about things like breathing and lungs expanding if they don't expand all the way when you're trying to take a breath. Capno means carbon dioxide. I know it doesn't really go with what it sounds like, but that's what it is. Hemo and hemato, we've already learned, means blood. Muco is mucus. Ortho, we've talked about before too. It means straight, so when we talked about orthopedic position, for example. Oxy is oxygen. Phono means sound or wave. Pio, we've learned already, is pus. Radio means, in this case, X-rays or ionizing radiation. So when we talk about like radiography, for example, that's where the X-ray or ionizing radiation comes from. Somno means sleep. I always think of insomnia, means you can't sleep. Sono is sound. And then we have spiro, which means breathe or breathing, and tomo, which means to cut or to section. So you'll notice, because we did jump around in the textbook, a lot of these are terms that you've probably picked up along the way, so hopefully it's not going to be quite as hard to learn all of them. There are a few prefixes that go along with this chapter, and most of them you probably know already. For example, a or an means absence of or missing without. Endo is inside. One you might not have seen yet is EU. EU means normal or good. So if you're breathing normally or anything normally in its normal body function, you'd use U. Poly means many, and tachy means fast or rapid. So whether it's breathing or heart rate or whatever it is, it's faster than it should normally be. So this is the chapter that formally introduces many of the suffixes that you've been using throughout different chapters. So in looking at this, I don't really know if there's more than one or two that you've not seen before. So for example, algia is pain, AR, ARY, EAL, as well as others not on here, all mean pertaining to. Seal means hernia or a protrusion of. Centesis, we learned last unit, is a surgical puncture to aspirate fluid like an amniocentesis. A rough one that we may or may not remember is ectasis. Ectasis means a stretching out, a dilation, or an expansion. So if you think about, the lungs expanding when you're breathing, that would be ectasis. Emia has to do with in the blood. Gram is a record. Graph is an instrument used to record. And graphy is the process. So those three terms go together. Gram is the actual image. A graph is the instrument that you'd use to get that image. And then graphy is the procedure where you would use the image, or you would obtain the image using the graph. Same thing with meter and metry. Meter is the instrument used to measure something, whereas metry is the actual process of measuring it. Pexy is a surgical fixation. Apnea, like apnea, for example, is breathing. So it has to do with whether you're breathing too much, not enough, so on. Regia is a rapid flow, so not just a discharge. If you remember, discharge is urea, but an excessive or rapid flow is regia. Then we have scope and scopic and scopy. Scope is the instrument. Scopic is actually pertaining to a visual examination, and scopy is that process. Spasm. A spasm is a sudden involuntary movement or a muscle contraction. For example, in this chapter we're going to have bronchospasms when the bronchioles involuntarily contract. Stenosis. Stenosis is a constricting or a narrowing, so the passageway is getting smaller. As you can imagine, that can happen in multiple places in the respiratory system. Then we have stomy, which is the artificial opening. A thorax, which references the chest cavity. And last but not least, tomy or tommy means cutting into or making an incision. There's a ton of suffixes here, but again, most of you probably know a majority of them already. So here's the first half of the list of diseases and disorders that are built from word parts. At this stage of the semester, I'm not going to go through each one individually because by now you should be able to put the pieces together and, figure out what the words mean. Here's the second half of that list. Again, these are from word parts, so you should be able to take what you've been learning all along and begin to put the parts together. Because I didn't go over each one individually, I really think that it's important to definitely do exercise 14, where you practice using each one of these terms and building the medical diseases. So here's a cartoon picture for atelectasis, which means incomplete expansion of the lungs, because you have atello, which means incomplete, and ectasis, which means expansion. So in this case, the alveoli part of the lungs are supposed to, fully expand, kind of like a grape-like structure. If they don't fully expand, well, then the entire lung can expand and fill with air. So you end up with this condition and see the picture on the right. Here's just a picture of what bronchiectasis looks like, which means dilation of the bronchi. And that's kind of what happens in the normal condition for the most part. You do want the bronchioles to dilate and actually allow air to get into the entire lung. But sometimes that process can go a little too far. And that's kind of what you're seeing in the picture here to the left. Here's a picture of what bronchitis looks like. So you might have heard of people getting bronchitis, especially in the winter. And you kind of think of it as a cold deep in your lungs. But really it has to do with the inflammation of the bronchial tubes. So you can see in the lung, if you have certain bronchial tube areas that are inflamed, then that's what the condition of bronchitis is. And those inflamed bronchi and can create an irritation that leads to the other symptoms that we might associate with bronchitis. So here we have two lung conditions that you can kind of see. The first one on the left is where there is a collapsed lung. So there's excessive air in the lung cavity. So that would be called a pneumothorax. In this case, it has to do with, a lung in the abdominal cavity. In this case, it's collapsed and there's air outside of the lung where there's normally supposed to be some. And then on the right, you have a condition where blood is now building up in the thoracic cavity around the lungs, and that would be hemothorax. Okay, here's the first part of the disease and disorders not built from word parts. This chapter does have a lot because there's a lot of things that can go wrong with the respiratory system. So the first one is called ARDS. ARDS, it stands for Acute Respiratory Distress Syndrome. So this is where for kind of a sudden onset period of time, an individual has trouble breathing. And so this could either be because of a disease, or it could also be some kind of injury took place and you're having a temporary problem breathing that in theory could be corrected. And for example, on the last chapter we talked about infant ARDS, for example, where some premature newborn infants have trouble breathing when they're born. Asthma is a respiratory disease, and it's characterized by coughing or wheezing or shortness of breath. And the reason there is those symptoms is there's a constriction and inflammation of the airways. And it kind of flares up in attacks. So if you're having an asthma attack, those airways constrict and kind of become closed. You get a shortness of breath that then kind of relaxes itself after the asthma attack is over. COPD, or chronic obstructive pulmonary disease. There's tons of commercials for this on TV for COPD. It is a combination of chronic bronchitis and emphysema, where both of these conditions kind of restrict your airflow and make it hard to breathe. And really, most of the time, COPD is caused by cigarette smoking. Not 100%, but most of the time. And so if individuals have chronic bronchitis and emphysema, then they're kind of lumped into the category of having COPD. The next one is a mouthful, coccidioidomycosis, and that is a fungal infection in the lungs that can sometimes go to other parts of the body, but it's a fungal infection of the lungs, which is where the myco comes in. And it's also called valley fever. Next is cor pulmonale, and this one is another condition that affects the heart. So this is a serious cardiac disease that is in this chapter because it's associated with lung issues like emphysema. So a lot of people that have emphysema or lung issues also have this kind of cardiac component. The next one is crup. It's also called laryngotracheobronchitis if you wanted to, have the mouthful from word parts. But crup is an acute obstruction of the larynx. And so you get a huge cough. That's usually the big giveaway. For example, my son just got over this and he was kind of hacking up for a while. And it's usually caused by either a viral or a bacterial infection. And it's mainly a disease affecting children, but it can happen in adults too. Cystic fibrosis, or CF, this is a hereditary disorder, so it has a genetic component passed down from parent to offspring. And in this condition, there's excess mucus that builds up in the respiratory tract, and that excess mucus makes it difficult to breathe. And so there's like I said, a genetic component to this disease where that can occur. Next is a deviated septum. We learned already that a septum is a wall between two openings. So in this case, your nose, the wall separating your two nostrils. So a deviated septum is when one or part of that septum is malformed in some way or injured, and it can make it difficult to breathe through your nose. So often then they would go and correct that with surgery. Next is emphysema, and that's kind of the key disease associated with a lot of smoking. But what happens is the lungs tissue, it stretches out. So the alveoli become distended and they begin to lose their elasticity. So they don't bounce back when you exhale and refill up when you inhale. And so eventually, because of that, you don't receive enough oxygen. Next we have epistaxis. Epistaxis is also called rhinorrhagia, and we saw that in the from word parts list. It basically means that you have rapid flow from the blood, or from the nose, and usually it's talking about blood, even though hemo or hemato is not in the word itself. Idiopathic pulmonary fibrosis, or IPF, is another lung disorder where there gets to be a lot of scarring and ultimately reduces your ability for the lungs to kind of do their job. And it's called idiopathic because the cause behind it is not really known. But it has to do with excess scar tissue building up in the lungs and making it hard to breathe. Next, I'm going to assume you all know what influenza is, or the flu. You've probably all had it once at least in your life. Alright, continuing on, we have obstructive sleep apnea, or OSA. Sleep apnea is when you are, in the course of sleep, you stop breathing. So that's what apnea is, without breathing. And obstructive sleep apnea has to do with how you are, laying, and during that process, your pharynx kind of collapse, and you can't get air down in through the pharynx to go into the lungs. So it's physically obstructed. And that can cause a whole host of issues, but that's what that particular type of sleep apnea is. There are more than one type. Next is pertussis, also called whooping cough. This is another kind of kid-associated disease. It's highly contagious, caused by a bacteria. And it's called a whooping cough because it gives you this really hard cough. Pleural effusion is what is next. And here we have fluid in the pleural space, meaning that around the lungs but not inside the lungs, you're getting this fluid buildup. And this can either be a injury-associated condition or a disease-associated condition, which leads into a pulmonary edema. Here we have fluid building up in the alveoli. So this is the fluid building up inside of the lungs, and that's often a conditional part of heart failure. Next we have a pulmonary embolism. We've, I think, learned at one point an embolus or an embolism is where you have a clot that breaks off and kind of travels through the body. So here we have a foreign material or a clot that makes its way specifically to the pulmonary artery and its branches and can block circulation to the lungs. And if circulation is blocked to the lungs, then it can't really pick up the oxygen that it needs to take to the rest of the body. Tuberculosis, or TB, is a bacterial disease, and it's highly contagious also, which is why a lot of times people in healthcare fields get tested for tuberculosis. And then last but not least, an upper respiratory infection. So we talked about the different respiratory tracts, the upper respiratory and the lower respiratory. The upper respiratory has to do with the nose, pharynx, and larynx. So an upper respiratory infection is often also called a cold. So anytime you have an issue with those areas, it's called a cold. So here's the cartoon for what obstructive sleep apnea looks like. So you can see in the normal individual when they're awake, the air can easily flow to the back of the throat and down the normal passageway. But then when this person is sleeping, then the kind of tongue and part of the throat, it gets closed off, and so you can't get that air down through the windpipe like you're normally supposed to. Alright, and here's a picture of what a pulmonary embolism looks like. So again, you kind of have a blood clot usually that breaks off in a certain part of the body and makes its way to the lungs, or to the vessels, surrounding the lungs. And you can see what that looks like in real life on the right here. That's an example picture of a blood clot that's, clogging up the arteries and veins around the lung tissue. As I mentioned before, the two different respiratory tracts, this slide just kind of compiles a list of diseases or disorders for you that fit into each one of those categories. For example, a cold or sinusitis, tonsillitis, all that stuff is upper, but bronchitis, pneumonia, and so on are lower respiratory issues. Okay, so these are the surgical terms built from word parts. At this point you can put these words together, so I'm not going to go through each one individually, but just pay extra close attention to the suffixes. There's a lot of surgical repairs or plasty, a lot of tomies, which are the incisions, ectomies for removal. One that I do want to draw your attention to is adenotome. We don't see tome very often, but that's the surgical instrument. So for example, the adenotome is a surgical instrument that we use to cut the adenoids. But to get some good practice, make sure you attempt exercise 22 so that you do at least put these words together 1 or 2 times. This graphic is just showing you that there are, a few different ways that you can actually resect or take out a piece of the lung. Obviously, it's ideal to leave in the most that you can, but when you look at the leftmost picture, this is kind of an entire lung removal, so it's a pneumonectomy. And in theory, you could swap out any of the word roots that mean lung to fit there. Also notice in the picture again, the person's right lung has 3 lobes and the left has 2, having to do with leaving some space for the heart. The next to the pneumonectomy is a segmental resection. So they're going to take a piece of one of the lungs. Then we can have a lobectomy where one of the lobes, either on the right or left side, is removed. And finally, a wedge resection. This is if they needed to take out a very specific or small portion of the lung. So here's what a typical thoracic surgery looks like, more recently. Originally, this was called a thoracotomy, or incision into the thoracic cavity, where they would make a large incision, and you can see that in the picture by the large red dotted line, to kind of access the lungs. But now they do a video-assisted approach where they make 3 smaller incisions and use a video camera to try to navigate, so that they don't have to cut the individual open so largely, and therefore increase recovery time. This is what a tracheotomy looks like, which literally translates to an incision into the trachea. This procedure would be used for anyone who's having trouble breathing. Maybe there is some kind of obstruction, or they're choking on a piece of food, their windpipe is collapsed, any of those scenarios. And what the person would do is basically do an incision into the trachea and then insert a tube that someone could attach to a ventilator or a bag that could, breathe for that individual, bypassing the obstruction. This is typically a temporary situation, obviously, so when the foreign object is either removed or the patient, gets better, then that tracheotomy can be removed and the individual can breathe normally again. Looking at this picture, hopefully you can see that the individual has a needle inserted into their lung cavity or pleural cavity. There's a pleural effusion there, and so they're going to remove the fluid. Because of that, this would be considered a thoracocentesis. Now we get to a giant table in this chapter in the book that goes through and talks about all the different diagnostic procedures that one can do. And so they're talked more in depth in this chapter, even though we've been kind of referencing them as we've jumped around the textbook throughout the semester. As far as what I want you to know, I really just want you to understand what the basics of each one of them are. You don't have to memorize this giant table, just kind of know the differences between the different tests. So here, the term diagnostic imaging is just a generic thing. And it covers everything from radiography to CTs, or computed tomography, nuclear medicine, MRIs, which are magnetic resonance imaging, and sonography. So those are all terms that fit under the diagnostic imaging umbrella. So I just put together a slide that kind of gives you a brief idea of what each one of the different diagnostic procedures is. So radiography basically means x-rays. So this is the radiographic images that you can get in various parts of the body after exposure to a mild amount of radiation. So you can see what the instrument looks like on the left and what a typical x-ray might look like on the right. Nuclear medicine type scans are scans that usually have some kind of radioactive tracer that the individual consumes, by swallowing a tablet, or they're injected with it, for example. And it gives information about organ function. And a SPECT scan or a PET scan are examples of nuclear medicine. In this case, you can see an individual in a PET scan machine and what the images of the lung look like on the right. A SPECT scan stands for single photon emission computed tomography. It's similar to a PET scan, but this nuclear medicine technique actually gives you a 3D picture of what's going on. So for example, it can show you blood flow through a particular organ. One example would be trying to assess cardiac damage after a heart attack. You can get an idea of blood flow through the heart. The other type of nuclear medicine technique is a PET scan, so positron emission tomography. And in this case, again, you're injected with a radioactive dye, and then you can look at that throughout the body. So here's a application where they're looking at cancer growth, and on the left you can see the individual. The tracer is attracted to the cancer cells, and you can see it's in a few localized areas. Then when you look at the same individual several months later, you can see that that cancer has now spread and it has infected various parts of the body. Sonography is also called an ultrasound or an echogram. And so in this case, you've already kind of learned this, but high frequency sound waves create an image. So traditionally we use this obviously for pregnant women to get an idea of what's happening with the baby, but this can also happen in other organs as well. You can get an ultrasound, the organs, to get an idea of functionality at the time. A CT scan is kind of like an X-ray, but in this case it's taking an X-ray slice and it can then, compile those images so you get a bit of a 3D picture of what's going on by putting all of these slices together. But you can see what the giant machine looks like and what kind of information it can tell you. In this case, we have a cross-sectional X-ray image of the person's, abdomen, if you will, and you can get a picture of all the different organs and kind of what they're supposed to look like. And this is advantageous because you can go in and out of the Z-plane or vertical plane and get an idea of what's happening kind of in a 3D fashion. So an MRI is an alternative way to kind of get 3D information. In this case, you're not using radioactive exposure like you would in an X-ray, but you're using a magnetic field. So this is why an MRI is usually preferred, but if an individual has any metal anywhere in their body, whether it be a pin from a broken bone or a permanent retainer or anything, they can't go into an MRI based on the magnetic field. Here's just other types of diagnostic procedures that might be done on an individual. For example, endoscopy just means that you are, visually examining some kind of organ or body cavity, looking at what's going on. Lab tests are ones like blood tests, tissue tests. You have some kind of biological sample that a test is performed on. And pulmonary function tests. So these are ones that we'll talk about in a little bit, but it helps figure out lung function. So here are the diagnostic terms from word parts. I'm not going to go through them individually because you know how to put word parts together, but just pay extra close attention to the suffixes here. On testing situations, a lot of you kind of gloss over that part, but focus on the difference between graph and graphy, scope and scopy, that kind of thing. Because as you notice, the first part of the word is the same on multiple words. So just make sure you do that. The only one that's kind of different on this page is polysomnography. In this case, somno meaning sleep. So it's basically a sleep study. It's where they do a whole bunch of tests while you're sleeping to try to figure out what's going on. Usually it's to diagnose sleep apnea, but it could be for other issues as well. Alright, here's an example of two different machines that you might use. So on the left is a Capnometer, and that's going to measure the amount of carbon dioxide. And you can see, you can kind of put your little finger in that little blue guy right there on the left, and then it will kind of read your stats of amount of carbon dioxide in the blood. And it can also tell you things like oxygen in the blood, and it gives you an idea of lung function. On the right, we have a spirometer. Some of you might have used one of these in one of the other science classes, but the idea is, you breathe in and out of it, and it gives you a clue as to your air volume or lung capacity. Alright, now we're to the ones that are not built from word parts. So they're a little bit harder to memorize. Under diagnostic imaging, we have something called a chest CT, which is pretty much exactly how a chest or CT sounds. It's a CT scan of that area of the body, and it's used to diagnose things like tumors or pleural effusion. A chest radiograph is also called a chest x-ray. So if they need to take an x-ray of the thoracic cavity to evaluate the lungs or the heart, then that's what that's called. The other diagnostic imaging is a ventilation perfusion scanning. So this is a nuclear medicine technique where they are going to look at your ability to have artery flow and imaging to kind of look at inhaled air and how that air gets distributed through the blood system. There's two lab tests that you can do. One is an acid bacilli smear, and that is performed to look for acid-fast bacteria which cause tuberculosis. So it's a way to do a TB test. The other is a sputum culture and sensitivity. So your sputum, as I think we learned at one point, is a fancy way to say your spit. And it's just a way to test it for bacteria. Arterial blood gas, or ABGs, that is going to test your arterial blood, which should be oxygenated, to look for the levels of oxygen, carbon dioxide, and pH. Next is a peak flow meter, and that's just an instrument that used to determine how fast air can be exhaled out of your lungs. So you breathe really hard into it, and this technique can help you monitor asthma to see if it's getting better or worse with certain medications. Pulmonary function test is a group of tests that measure your ability to breathe. So it helps determine respiratory function and look at things like asthma and COPD. And then we have a pulse oximetry, or pulse ox, and that is where the little device attaches to your fingertip and can measure the amount of oxygen in your blood through the skin. Alright, so finishing off the list here, we have a few other common things that are done in the doctor's office. One is auscultation, and this is where the person takes the stethoscope, which is another one lower on the list. The stethoscope is, the instrument that they put in their ears and listen to your heart and breathing and everything with. And for auscultation, they are kind of working their way, as you can see in that leftmost picture, just kind of working their way back and forth down the back, listening to you breathe, and they're trying to listen for issues with your lungs or heart or abdomen. The next one is percussion. I always think of like a drum as a percussion instrument, but this is where the doctor taps on your back, and they kind of are feeling for the density beneath, kind of get an idea for maybe fluid buildup. If they tap on it and it's kind of dull, then it could mean that there's fluid in a body space or body cavity where there's not supposed to be. Next we have a PPD skin test. It's also called a TB skin test, which is probably what it's mostly commonly called. But the idea is they inject the individual intradermally, so that's kind of in between the layers of your dermis, and wait to see if a reaction takes place. If it does, that's an indication that the individual has been at least exposed to tuberculosis. So that's kind of a common test that people do if they're suspected of having the disease. This brings us to the complementary terms. This slide and the next are ones from word parts. I'm not going to go through each one individually like I will with the ones not from word parts, but you can see they're all associated with issues of the respiratory system. In this case, we have lots of hyper, hypo, depending on what you're talking about in the respiratory system as well. Here's the second half of the list. Again, for more parts, I'm not going to really go through them. But work on exercise 35 to get some practice with these at least once so that you're more familiar with the words. Here I just wanted to go over with you the different conditions of breathing, because they do sound a lot alike. Apnea is when you stop breathing. Dyspnea is painful when you try to breathe. Eupnea is just normal, regular breathing like you're supposed to. Hyperpnea is excessive breathing, whereas hypopnea means that you're not breathing enough, it's deficient. Orthopnea means that you find it easier to breathe when you're sitting up, so you have a hard time breathing when you're laying down. And then tachypnea means rapid breathing, and it kind of goes hand in hand with hyperpnea. Okay, so here's the last major list of the chapter, the complementary terms not built from word parts. And some of them you might already know. For example, airway. Kind of easy to think about. It's just the passageway that the air travels through. Asphyxia is the fancy way of saying suffocation. So you are depriving oxygen from the tissues, so that's what that's called. Aspirate, when you think about aspirating fluid, for example, it means to withdraw fluid. In this case, oftentimes it also means that you get a piece of foreign material in the respiratory tract. For example, you choke on some kind of food because it goes down, the wrong tube. You are aspirating that item. Bronchioconstrictor is, a chemical that's going to constrict, whereas the bronchodilator, like a asthma inhaler, is a expander of bronchioles. Crackles are a sound that's heard with a stethoscope when they're listening to you breathe. It kind of sounds like rustling cellophane, and that gives the indicator an idea of potential pneumonia or even heart failure when they hear that. There's hyper and hypoventilation, which has to do, you're breathing too much or not enough for what your normal body system needs. Mucopurulent means that it has both mucus and pus. So just imagine a condition where something has both mucus and pus in the airway. That's what that is. Mucus being the slimy fluid that's secreted by a mucous membrane, which really is a general term for any body part or that has a mucous membrane. Nebulizer. A nebulizer is a device that basically mystifies medicine, so it turns it into a mist that then someone can breathe in, and it helps treat respiratory issues. Nosocomial infection. This is an infection acquired at the hospital. And really this one is kind of applicable to all chapters. It's just any stay in the hospital where you acquire an infection, that's what it's called. Paroxysm is a periodic sudden attack. For example, asthma, if you have periodic sudden attacks, that's paroxysm. Patent is an open airway. So think of a happy, healthy, open airway like it's supposed to, not a closed or constricted or blocked airway. Rhonchi. Rhonchi is a snoring kind of sound that one hears through the stethoscope, suggesting that there's kind of buildup of secretions in the airway. Sputum, as I mentioned before, is basically your spit. It's the mucus secretion from your lungs and your bronchi and your trachea. So if you hacked a loogie, that's your sputum. Stridor is another sound that someone would hear with a stethoscope. In this case, it's kind of a high-pitched breathing sound, and it indicates that someone has some kind of larynx obstruction. The final term, ventilator. This is a mechanical device that's basically doing the breathing for you, whether it's temporary or a permanent situation. Okay, you're going to notice that there are tons and tons of abbreviations in this chapter. Yes, you will be responsible for knowing what these different abbreviations are, but most of them just follow along with whatever the condition or the word is. So in that regard, you should be all right. We are now to the end of the chapter, so please, practice reading these terms aloud and being able to understand the context and defining what these boldface words actually mean.